Hi, everyone, and welcome to the 24th episode of Battles and Voices. I'm Lathika, and I'm the founder and host,
And I'm Camden, and I'm the co-host.
and we serve on the executive team of Battles and Voices. Battles and Voices brings together various experiences within healthcare to inspire the next generation.
Please welcome our guest,
Yesenia.
Yesenia.
Thank you so much for being a part of this episode. It means so much to us that you'll be one of our guests today on Battles and Voices. Feel free to introduce yourself and share some things about yourself as well.
Thank you guys for having me. My name is Yesenia Malave. I'm a certified nurse practitioner. I'm a family nurse practitioner with a specialization in urology in the state of Florida.
Alrighty, so we'll get some started with some questions for you. So can you tell us a little bit about what inspired you to go into healthcare and what you do currently?
Absolutely. So, what inspired me to be a nurse was a personal situation where I recognized that there was a lack in actually recognizing early symptoms of a disease. And I was like, maybe if I was familiar with this, I may have been able to recognize that this person was going through this situation, and maybe I was going to be out of health and promoting, longevity in that case. That inspired me to go into nursing. I ended up studying in Puerto Rico, my bachelor's. Then I moved to Florida and I proceeded to work as a medical surgical nurse. Then I was in the ICU during COVID. While I was in ICU during COVID, I finished my master's degree in family nurse practitioner. And I currently work in urology practice, serving patients of 16 and up for the most part, helping them be their best, healthiest as far as what urology entails.
That's
Well, that's
beautiful.
wonderful. Yeah. So I know you talked a little bit about Florida. Can you tell us some challenges you faced while becoming a nurse in Florida?
Yes. So becoming a nurse in Florida was very challenging. Despite Puerto Rico being part of the United States, the bachelor's teach in Spanish, so it was treated as a foreign bachelor, but a foreign degree. In this case, I have to go through certain reviews through specialized companies who will determine if I was able to sit for boards here in Florida. That process was long, it was exhausting, and it took at least a year for me to be able to test to be a nurse. That first NCLEX, I failed. I think language barrier was a big factor. So I took the challenge and then I booked a second time and I sat down every day. Nobody could bother me. Just going through a review, reteaching my whole bachelor in a couple hours a day, completely in English, and practicing a lot of questions. Finally, that second attempt, I was able to pass it, and the relief was unbelievable after that.
Well, I love to hear the perseverance, and that's a beautiful story as well. How do you think that providing care to all to patients of all ages gives you a unique perspective on things?
Pretty much, we're able to see diseases and illnesses across the lifespan. You get to be familiar and know what things are more common in certain age population, how to help them. Also using variety of language because you may not speak to an elderly the same way you speak to a teenager, and vice versa. You get used to promote healthcare in the certain lifespan, certain age, and you manage to help them get a successful health outcome.
That's wonderful. So I know you touched a little bit about language barriers. So how do you
Mhm.
feel, in your own opinion, that language barriers can impact health outcomes directly?
It can impact tremendously. As a matter of fact, here in Florida, there's a lot of Spanish speaking patients, especially in the area I serve. It is very rewarding for them not only to see that somebody is able to translate, but to understand the culture. It's not the same. You have somebody through a screen doing the translation for the whole visit versus you having a provider where there's not that gap in between that can speak your own language and help you achieve the healthcare outcomes. When patients don't really understand your plan there's so many variations in Spanish. There are Mexican Spanish, Puerto Rican Spanish, Colombian Spanish. So when you don't get to the message correctly, that can impact tremendously their health outcomes because they're gonna leave their appointment without really understanding what are they supposed to do, what is my plan of care, what is this medication meant to do, because not all translators are going to use the appropriate words in some of them do not have, they may have like a basic medical translation language course but not specific to urology. So it is very rewarding for me to see when patients actually are able to take control of their health when you communicate properly what the plan is, what the medication is for, and you can see that they have good outcomes.
That is incredibly and wonderful, and I love the work that you're doing personally as well. Is there anyone in particular that gives you the motivation to keep on going when things get tough at work?
Absolutely. Support is everything. And I have a really good group of colleagues and at work. My supervising physician, he is amazing. He definitely does. He's there always for any questions that I have when I have doubts, when I don't feel like, hey, I'm lost. What plan of care should this patient have? So having the correct support from the right people, more experienced people, definitely makes a huge difference in the impact that you can do in your patients, especially when tough times come or this patient is completely off the guideline, completely off the book. You don't know not all patients fit the guidelines. So it's definitely having a colleague within your own group of specialty, it's necessary.
Yeah, I definitely agree. I think, as you mentioned, support is very important in healthcare systems.
Absolutely.
So, are there any hobbies that you have outside of work that can help take your mind off things?
I do have two little kids, so they are my hobby. We try to make good memories with them and enjoying all the holidays. Also, I love to dance and we love to do art. My daughter and I love to do art, and I think my baby is he loves the music and dancing, so we get to do that on our downtime.
That's so cute. I love
Mhm.
that. How does it feel going back to school to achieve your doctorate in nursing? And congratulations on doing that.
Thank you. It's challenging for sure. I just like to sign up myself for more suffering, I think. And it's I am looking forward to finish the doctorate. Is the highest academic degree, and it takes a lot of time and a lot of effort, but I think I'm just an overachiever and I like to study and I like to always pursue more.
Yeah, I can agree. I'm definitely an overachiever as well.
I can agree
Yeah.
with both of y'all as well.
Mm,
And congratulations on achieving your doctorate in nursing. It's really a wonderful goal of yours. So talking about goals, are there any other goals that you have in your future with your own career or outside of healthcare?
I first want to focus on finishing my doctorate in nursing practice. Definitely. I know that finishing that will open so many other doors. In the end, one of my goals is to teach. I will love to be involved as a assistant professor, adjunct to a university, to be able to help new nurses become a nurse, absolutely.
That's so good. I love that you're going to be able to give back to your community once that time does come. Um, is there something that you wish people would understand about nursing or even urology? Urology.
Absolutely. As a nurse practitioner, I would like to invite all the population to give the opportunity to a nurse practitioner to treat them. Doctors are overwhelmed, they are overbooked, and we are here to assist them. Most of patients, especially the elderly population, still don't understand the role of a nurse practitioner or a physician assistant as an advanced practice provider. So we are working in collaboration with the doctor. We do go through different training, but to meet the same end goal, have a good healthcare outcome for the patient, listen to their patients. So my advice is for if you never seen a nurse practitioner and doctors probably are booked a couple months out and you have the opportunity to see a nurse practitioner, please go for it. Give that person the opportunity to be involved in your care because you will not regret it.
Yes, I definitely agree with you. And to wrap things up, do you have any advice to give to any of our listeners who might be listening right now, who are unsure about if they're doing the right thing?
We never know what we don't know is the first thing that I always like to say. You'll never know what if it's the right thing. And if you are already doubting if it's the right thing, it's probably the right thing. Just follow the gut instinct and always pursue more and more. Do not get comfortable in like that comfort zone. Always try to go above and beyond and give the best out of yourself, whatever you want, decide to do with your life.
I think that is some wonderful advice, and thank you so much for sharing your story in healthcare and giving our viewers their motivation to move on forward.
Absolutely. It's
Definitely.
my pleasure.
It's so inspiring to hear about some of the challenge that you've overcome and your plans for the future.
Thank you. Thank you. And I wish you guys as well very well with this podcast and any ongoing projects.
Thank
Thank
you.
you so much. And to everybody tuning in, thank you so much for joining on this episode of Vitals and Voices. Your engagement and loyalty means so much to us.
If you enjoy this conversation, be sure to follow, share, and stay tuned for more voices with passion and perseverance on Vowels and Voices.
We'll see you next time.